I do believe that each pet or each dog is placed in our lives to teach us something, right? Right when we need them most, even though we don't maybe realize what that life lesson is. And so I think I've been blessed to have a few dogs, or for some people, maybe many dogs in our lives at just the right moment to fill that need and give us a life lesson. It doesn't make the pain go away, but hopefully it makes it a little bit easier.
Welcome to the Good Life Coach podcast. I am your host, Michelle Lamoureux. The intention of this show is to awaken you to your fullest potential. Join me each week for inspiring interviews to elevate an area of your life, as well as interviews with women entrepreneurs who are creating success on their own terms. Each episode provides actionable tips to guide you to design a life you love. Hey there, it's Michelle Lamoureux, and welcome back to the show. Today, I have a very special guest on, and it's an angle we've not covered before. It's a beautiful memoir written by Dr. Renée Alsarraf, who's the author of Sit, Stay, Heal, What Dogs Can Teach Us About Living Well. Now, in this beautiful memoir, Renee teaches us so much of what we can learn through the families of these beautiful dogs and how the dogs navigate cancer, because Renee is a veterinary oncologist, and you've performed numerous veterinary clinical trials, co-authored peer-reviewed journal articles, and lectured both locally and on a national level. And Renee wrote this book actually because she too ended up getting diagnosed with cancer and had all these profound awarenesses from her beautiful pet patients and how they've navigated in her own journey. And today we're going to be unpacking her story and learning from her experience. And I'm just so grateful to have you on the show today. Welcome, Renee.
Thank you so much. It's a pleasure to be here.
Yeah, your memoir is so beautiful. I was telling you before we hit record that I teared up a lot. I had never been a pet owner before, and a year ago, almost to the day, we got a puppy, a beautiful Australian Shepherd, Kona, and it has transformed all of our lives. My husband had had a pet before. My daughter was, as many kids do, begging for a dog, and we made that journey. And reading the stories of all of these families that you have helped navigate and all these beautiful dogs that you've helped live longer, done your best to help extend their lives, really touched my heart. And I'm just grateful for the work that you do in the world. It's clearly your love and your gift, but you're so wonderful with these families, and you see that in the story. So I just want to acknowledge you and just thank you for your work.
Oh my goodness. Thank you so much. That means so much to me. I really appreciate that.
Yeah, no, for sure. I mean, it cannot be an easy job, but it seems like, you love what you do, even though it's hard. Can you speak more to how you got into specifically, because your husband's also a veterinarian, but he's an ophthalmologist. He's an eye.
Correct.
Okay.
An ophthalmologist. So he does eyes in dogs and cats and ferrets and birds and, even Shamu the whale. But it's not an easy job. So many people say, oh my goodness, your job must be so difficult.
Yes.
And while the topic is, for me, my job was more of a calling, as sort of you stated, to be able to give that pet family, another holiday season or a few more summers, and to get to really know them and how that dog, and see how that dog helps them, what that pet means to them, just fills me right back up. I had wanted to be a veterinarian ever since I was 7. I was going into 3rd grade, and throughout all the years, so many people would say, oh my goodness, it is so difficult to be a veterinarian. Why don't you apply, to medical school? It's easier to get into medical school. I think my father would have paid me to have applied to medical school, but I never wavered. I never thought about any of that. I knew that this is just something I wanted to do.
Wow.
Yeah.
So here you were at 51 years old, treating dogs and other pets, animals with cancer. And then you got your own, I know you like to call it the C word, right? We're not going to call it.
I love you. Thank you.
We're going to call it. Yes.
I'm not owning that word.
That's okay. Let's not.
Yes,
Who said
right?
it's a word. You don't have to. You
Correct.
call it what you want to call it, right?
Correct.
So we're going to call it for you the C word.
Yes. And the technicians that I work with would be like, Dr. A, that's not what the C word means. But for me, it was just not a word I was ready to say. As you read in the book, at least now it's a lowercase c and not a capital C.
God.
So we can downgrade that, not give it any power.
That's right. Yes, you're in remission, just for everyone to know, right?
I am. I just went to my medical oncologist in July, and she actually said I don't have to come back for a whole year, which felt great. Yes, thank goodness. But there's some security in being checked. So, right, even though you don't want to, and I might fret ahead of time. So I talked her into seeing me in 6 months. Just in case.
That makes sense. And it makes sense. And even the stories you talk about, and we're going to talk about that today, because it seems like the way that there's care for animals who are going through cancer is different in many ways than it is for people. Is that right?
I think so. And I think part of it is how we as people approach it compared to how, say, for instance, my dog patients would approach it. And I think, I hope that there are things that we can learn from that.
Yeah. Well, why don't you share some of what you were learning? So actually take us a little bit into your story. So how was do you mind sharing about how your cancer was discovered? Or the C word was discovered.
Yeah, that's okay. So I am the poster child as to why we should all get checked every single year. I was 51, this may be TMI, never missed a period, wasn't lethargic, hadn't lost even a pound, unfortunately. But I usually go to my gynecologist every August. And for whatever reason, back in 2018, I had made my appointment in June. And I remember as that appointment approached, I thought, well, that's crazy. Why do I want to do that 2 months early? Yeah. But I had already booked out of clinics and appointments. And I thought, fine, I'll just get it over with. Yeah. And so I went in and during the exam, my gynecologist found what she had hoped was a little nodule in my uterus. Unfortunately, after the biopsy, it was endometrial carcinoma. I had surgery about 10 to 14 days later. At the time of surgery, thank goodness I had a great surgeon. He found a 3 millimeter lesion or metastatic spread outside of my uterus. And as horrible as that was, thank goodness he found that, right?
Yes.
Thank God, because that probably saved my life. It was because he found it that I ended up having 25 treatments of radiation therapy and many months of chemotherapy, which nobody wants, but I will take that if I get my life in exchange.
That's right.
Yeah. So,
well, I'm sorry that that's what happened, but you're right. It's a good reminder to, just show up for those appointments, even though they're not pleasant, because, because you had really nothing indicating that there was something wrong. But it sounds like with these patients of yours, there's the families are seeing things that are wrong. Right.
Sometimes, right. So the most common type of cancer in dogs is lymphoma, which often shows up as big lymph nodes.
Same place as humans, like right under our neck?
Exactly. Under our neck and our shoulders, behind a dog's hind legs, like behind their knees, in their underarms, their axilla and in their groin. And, for many of those patients, they have no clinical signs whatsoever, except for those lumps and bumps, if you will. So sometimes, pet families will feel them, or they'll take them to the groomer and the groomer will notice, or they're in for their routine shots and their veterinarian will notice. Other times they will have outward signs, maybe not eating as much, acting as vigorously as they used to, drinking more water, urinating more.
Mm. And is it common for dogs to get cancer? Is this a common thing?
Hopefully, you'll never know anyone.
Yeah.
The average age dog that gets cancer is usually about 10 years of
Yeah.
age.
An older
So
dog.
they are older.
Yeah.
It is it's more common, say, than when you and I were growing up as kids. In part, though, I think it's because all animals are living longer. They have better care, better nutrition, right? They're not dogs
Yes.
that are just running around the neighborhood. They're either kept, in a fenced backyard or on a leash. So any of us, the longer we live, have a greater chance of developing that.
Yeah.
For some breeds, it is genetic
Mm.
and often having nothing to do with the breeder or the breeder before them, but having, something that was perhaps bred in them maybe, golly, 50 years ago or so.
Right.
That was the
Yeah.
case for boxers. They were a very healthy breed up until the 50s. Then they became a very popular breed. And unfortunately, there were a lot of backyard breedings and recessive genes bred in them. So now they are more genetically inclined to get certain cancers than other breeds.
Right.
Yeah.
Yeah. And boxers are your favorite breed. That's the one you had
Yes.
since you were a little girl. And so part of your story is Newton, your dog, your boxer.
Mhm.
Nudie, you call him, right? You call
Yes,
them.
exactly.
So can you take us a little bit more into sort of this journey of what happened while you're caring for patients and what happened with your own boxer, with your own dog?
So as I'm in the middle of my chemotherapy, sort of just finishing, well, actually still probably in with radiation therapy, I, unfortunately was convalescing on the sofa and my, chemotherapy hair was plastered to my scalp. And I reached down to pet my four-legged nursemaid and I just stutter because I feel enlarged lymph nodes right under his neck. And I thought, how could that be? I can't be right, or do
Right.
I have on just my veterinary oncology glasses that I think every lump is that?
Right.
And yet I think in the pit of my stomach, I knew. And
Yeah.
when I had the heartbreaking job of telling my family, my son and my husband, even before we did the diagnostics, I think they knew as well. So, you always want your dog to be by your side and your companion, but you never think that you are going to be getting chemotherapy side by side. But that's what happened. He went through chemotherapy while I was going through my chemotherapy, which was hard. In the beginning, he took it like a champ, didn't miss a beat, come home, run to his food bowl to see if there's, miraculously his food has just appeared there.
Yeah.
Didn't miss showing up for my son. But sort of as the shoemaker's children, I guess, never have shoes or whatever that phrase is, he didn't make it to the odds. He didn't beat the odds. He didn't even make it to the averages. And despite the many different protocols that we attempted, the cancer won out, which of course, as you can imagine, left me with a whole host of feelings, right?
Yeah.
I don't think I had survivor's guilt, but I did have more than just mourning my dog. I felt terribly, second guessing myself. Did I do enough? I did everything I could, but we still always look back, as if, hindsight is 2020. And I perhaps maybe foolishly thought that we're in this together and we're going to beat this together.
Yeah.
And then when he didn't, it caused me to pause about my own treatment.
Yeah.
Someone, not me, but someone had suggested that perhaps he lost the battle so that I could win mine, right? Which is touching and hard all at the same time. And then, especially for those people listening who have to make those hard decisions, going through that with a child is so much harder and different than going through it by yourself or just with your spouse. Because I think as moms, right, we're the mama bear wanting to protect our baby bears.
Yes.
And while these are all life lessons, we don't want our kids to be in pain or to hurt. And for my son, it was hard enough that he had to have all these feelings because his mom was going through it.
Yeah.
And then his dog, as we would call his big brother, because my son's an only child, he had to experience it as well. And yet I know for his own emotional health, he needed to feel all those feelings, right?
Yes.
And we needed to talk about it and to process it. But that doesn't make it any easier.
No, not at all. Not at all. And I'm sorry that was the result. And that's, I think that's part of the beauty of your book too, is just like all of the truth of I don't know if you're finding this. I mean, I'm in my 50s too now. I'm 51 and just in midlife, it's like this new awareness. I don't know. It's like the weight of you have the aging parents, you got the pets, yes. People are going through their own healing journeys or yourself, or, it just seems like it's more. And I totally agree with you that when you have children, you want to, I don't know. Yeah. The mama bears, we want to protect our children from any suffering or pain. And yet also one of the gifts of pets too is the ability to sort of navigate the truth of life through the loving of, these unconditionally loving beings.
Correct. And that's what I tried also to relay to Peter, my son, as hard as it is, and how we all would wish that our pets would live a whole lot longer than their natural lifespan.
They should.
Right?
I don't understand.
They should. I know.
Yes. Why do they live such a short life? Yeah.
But I do believe that each pet or each dog is placed in our lives to teach us something, right? Right when we need them most, even though we don't maybe realize what that life lesson is. And so I think I've been blessed to have a few dogs, or for some people, maybe many dogs in our lives at just the right moment to fill that need and give us a life lesson. It doesn't make the pain go away, but hopefully it makes it a little bit easier.
Absolutely. I think that's beautiful what you shared. And, tell us more about what you were hoping to impart in your book, because even just what you talked about, you talk about how these dogs that you care for navigate their diagnosis and their ability to be just fully present. I mean, it's so different than our human brains. And as you talk about a lot of the what if situations that we can have a hard time unhooking from. I mean, it's just how we're wired, right? I mean, we can imagine so many situations, but the dogs are just in the moment with us, right?
Right. And they practice mindfulness, or they mirror that for us. And, you'll hear of like a girlfriend going to a spa weekend with another girlfriend, or I will. And then I come back and I'm convinced I'm going to change and improve my life. And by Tuesday, it's out the window. But perhaps we could use the dog as the guide for many things, but for just living more in the moment. I know I can fret with the best of them. And, even before walking in, getting my chemotherapy, I have just a jumble of thoughts in my head. How am I going to look? Will I get sick? How sick is sick? What will people think? It does no good but to waste my energy that I needed to heal and to bring me down, right? It doesn't help my cork to float at all. And even after the procedure, as I'm leaving, I'm thinking, it took the nurse 3 times to put the catheter in me. What will happen the next time? I don't leave it in that cancer center. I bring it home and I lament, but it doesn't do us any good. It really doesn't. And maybe just to fret a little bit less, to realize that just sometimes showing up in the moment is all we need to do.
Yeah. Yeah. And also, as one woman looking at another woman who's been through this, challenging journey, saying, however you navigated, it sounds perfect to me too. Do you know what I mean? Because we all do the
Yes,
best we can
I agree.
in that moment, and maybe sometimes feeling a little bad or lamenting a little is okay. but
Yes, correct.
but you wanted to share. So tell us what your hope is with, somebody's reading your beautiful memoir. What do you hope that
Oh,
they're understanding from these beautiful dogs that you've had the honor of caring for and extending in many situations their
yeah.
lives?
Hopefully a few things. I think for me, the overall message is how dogs can be these incredible guides to all of us when we struggle, whether it's the C word or something else, right?
Yes.
And I think and I hope that the book gives them this front row seat to the enormous impact that the human animal bond makes in all of our lives. I hope it validates it for them and for other people who don't even understand that human animal bond. So, I think we're fortunate in society. I know, a couple of decades ago, mourning the loss of your pet wasn't really accepted, or you shouldn't take a PTO day off because of it. And now people understand that more. These are part of our families. These are loving, beings that give to us unconditionally and we give to them. I hope it speaks to the power of women. I hope it speaks to the mom, and what we have to navigate. Working, family life, and then dealing with our own struggles or facing our own mortality or talking our child through all of these hard decisions. I hope it resonates for people when there is an end of life decision to be considered, and sort of provide some guidance and some caring. And of course, just the very obvious, for anyone with a pet, who is sick, just understanding that process. I hope it provides some insight into the differences between veterinary medicine and human medicine. And, certainly human medicine is extremely advanced and, thank goodness for that. We all benefit. But perhaps there are some lessons from the veterinary world that would make the, human medical world a little bit easier for all of us.
Yes. Well, I think your book does that beautifully. Actually, could you speak to that last part? Because I did find that interesting in terms of how things are done with animals versus your
Yes,
experience.
yes.
Could you speak to that a little bit?
Um, I guess if you want the differences between human and animals.
Yes.
Okay. So obviously, both are, as the years have gone by, both are much um, are very highly skilled and knowledgeable, and human medicine much more so. Lots more money for research, et cetera. Both have subspecialties. Humans even much more so. You're not just a surgeon; you're a hand surgeon or a
Right.
cardiothoracic surgeon. But I think sometimes those specialties in human medicine have gotten a little far from treating the whole patient, right? We all go in to see our doctor for whatever, and you show them a little, I don't know, wart on your skin. And,
Right.
the first answer is you should see your dermatologist, or you should see someone else.
Right.
And, I get from perhaps a litigious society, people do that, but they've had the training, they know this, and in veterinary medicine, I think we treat, even in subspecialties, we treat the whole patient.
Yes.
I think too, in human medicine, you go in with a condition and your physician tells you what you're going to do to treat it, how it's going to be, and we follow that often blindly. Whereas in veterinary medicine, or specifically for these pets with cancer,
Yeah.
we might talk about different chemotherapy options, what each prognosis would be, what the chances are of side effects, what, how much it will cost. And what if we don't treat? Well, then these are the palliative things that we can do, so that we're giving more knowledge for that family to make an educated family decision.
Yeah.
And, lots of times people will say, hey, doc, what would you do? Well, I can't make that decision, but I can help guide them, right? I believe that knowledge is power.
Yes.
And so the more we know, and it really depends for a pet parent. It depends on finances. It depends on their risk tolerance, on their ability to come and go. And sometimes just because we can do something doesn't always mean it's the best thing. But I think in getting to know that family as veterinarians, we then honor that family dynamic in their decision process.
Yeah.
And I also think it helps families to feel that they have some sort of control, right? I mean, medicine is not an exact science. But at least the last thing, anyone wants to have with any of this are any regrets. And so being a part of that decision, I think, helps with that.
Yeah.
Another decision or another difference that I noticed is, despite how many of my physicians that I asked, no one would give me my prognosis, percentage of going into remission, the whole thing. And I'm very type A, numbers based.
Yes.
Whereas in veterinary medicine, we do that, right? We can give the percent chance of going to remission and for how long, sometimes in, days or weeks or months. I do understand from the medical community's perspective that it doesn't really matter what the masses do. It doesn't matter what the average human patient does. If you're that 10% that does poorly or the 20% that hits it out of the park. And I assume they also don't tell us because they want us to go in with the best possible attitude.
Interesting.
Right?
Maybe because they know we will ruminate and have those what ifs and create more mental worry.
Exactly.
Right. You don't have to worry about that with the dog that you're treating by telling the parent, the owners will be worrying.
Yes.
But the dog won't. It's not going to impact the dog, right?
It won't, right? And that dog will always have that positive mental attitude when he comes in looking for a biscuit. So that's all good.
Yeah, I remember reading that in your book, and you're saying, wait, why can't you just throw a number out there? Give me a percentage. Right. And then they won't do that. Right. Yeah, I guess that makes sense. But I could see why you would want that. It's helpful to understand, just something to wrap your mind around, right?
Exactly. Something for me to try to strive to do better than.
Right.
Yes. Yeah.
Right. Are there any other key differences? I think one of the things that I remember reading was just the whole family usually comes in, or the people are coming in with the pet, and you see them through the end, and it's very hands-on with your whole team, and everyone's involved. What was it like because you talk about this little in the book about some people are showing up alone, and there was the bell to ring after the radiation treatment, but nothing after the chemo. Tell us a little bit more about some of the differences there.
Oh my goodness. Yes. So after radiation, in the radiation unit, they have you ring this loud bell, which I didn't want to ring because I was still having chemo, but I rang it, as I say in the book, loud and proud. But, I think dogs teach us to celebrate the small things in life, right? My dog's happy that the sun came up every day, or that, she's going to get another treat, or she gets to play with her Snoopy toy again.
Right.
And so one of the things we try to do when they're done with chemotherapy is provide a diploma and make it a big special occasion. Whereas when I was done with my chemotherapy, I ended late that day, and it was as if they were just turning off the lights and, they were sweeping the floor, and I just, walked out with my tail between my legs, feeling just a shell of myself. And I think that was very hard. I think that could that could improve just to make it a happier situation, not okay, go home now and maybe you're going to be sick for a few days and then you have to gain your strength back.
Right.
Yeah.
I wonder if you could use your book to go into these hospitals and give a talk and just especially because you are in the medical field. I mean, you treat animals, but you're treating cancer. And so sometimes it takes new awareness to realize that some of the procedures that exist aren't always the best or the most empowering or the most supportive of a patient, just because people are, I think within the medical community are just so exhausted themselves, right? And just like checking boxes, and everyone's maybe just thinking about themselves, not because they're selfish. It's just the way the system is set up, right? And so I'm just thinking just out loud a little that maybe you could use this to go to talk to them and give them a new perspective, because I think it could make a difference.
Oh my gosh, I would love to do that. Completely open to that. And I think they're just very small things, but enough of them that it would really help.
Yes.
And doing it from a dog's eye perspective, nobody's going to posture against that. It's easy to take.
That's right. That's right.
To understand.
That's right. Are dogs allowed or no?
Well, therapy dogs are allowed in some hospital situations.
They are.
Which, yes. And I think with time, more and more centers are trying to do that. And it showed such great benefits. You always hear of that helping children or the very sick or people who don't want to communicate. And then you bring in this dog who, one of the big lessons, sort of every chapter is about different lessons in the book. But one of the big lessons is that they meet us where we're at. Right? They never judge us. And that's so freeing, right?
Yeah.
You feel seen, you feel heard, you feel unconditional love. It doesn't matter if we've lost our job or we, said something silly. They love us just the same. And I think, it's human nature to judge. We all perhaps try at times to not be so judgy. But I know I also have this little voice in my head who is not very nice to me. And dogs don't have that. But mine puts me down. And I should take my cue from our four-legged friends and dismiss her, not allow her any stage time to talk to me like that.
Right. Right. Just their presence is such a powerful reminder. And it's true, like you talked about in the book, doesn't matter if you've lost your hair or gained weight from the chemo or whatever. The dog is not looking, it's an energetic exchange of just pure love. They're just so happy that you're like in their lives. I mean, it's just, like I said, I always thought dogs were amazing, but I had no idea just how powerful and healing and, amazing just having the presence of a pet is. And, there's people who are listening who have cats or other animals, same thing, right? Correct. I mean, it's all the same. It's just this story, the memoir is, is the dogs that you treated. And Franny was one of the ones that touched me the most. Can you just tell us a little bit about Franny before we wrap up today? Because I loved all the stories, but Franny's was very, very sweet.
So Franny, I can say is, because she is still doing great, is a female spayed bloodhound who came in with her police partner, gentleman, and she had just had surgery for a bad type of cancer in her stomach. Unfortunately, the prognosis really was just a few months with or without chemotherapy. After lamenting the decision, going back and forth, the police officer and his precinct and captain decided to go forward with treatment. Their biggest concern was that she wouldn't still be able to smell, and she was search and rescue, and she would find, lost children, or perhaps, people suspected of committing crimes that have, that are on the lam. And we treated her. She started out, I don't remember her exact weight. I want to say somewhere in around 100, or I'm sorry, somewhere around like 70 pounds. And she did great. He brought her in every single week for 4 weeks, then every other week for 4 weeks. And then we spaced it out to every 3 to 4 weeks thereafter. Multiple times she would be in the newspaper. He'd bring us a clipping of someone that she helped track down when other dogs or other teams couldn't find that person. I had nominated her and she won for New Jersey Dog of the Year, which, was fantastic. She, as a bloodhound, drooled, unrelenting. What is the word? Like continuously.
Yeah.
Yes. Yeah.
Continuously.
Full of wrinkles. And she gained a lot of weight because, down at the precinct, everyone felt sorry for her. So they would give her extra treats. We gave her treats at the veterinary clinic, and she ended up being about 121 pounds from being somewhere in the 70s.
Wow.
And she didn't care. She loved life just the same. And here I was stricken with the side effect of lymphedema, which, made me look and, heavier. And the scale certainly said I was heavier. And I lament that, I was beating cancer, but I felt badly about myself, which is such a waste, right? I'm doing all of this so that I can live and enjoy, but I can't get out of my own head. Or, we all look in the mirror and see wrinkles and gray hair, but the dogs just love living and being here. And so to take that cue from her, they ended up retiring her because with all the weight she had gained, she was slow, in the marshes and the fields and through the forests trying to track down. But it has been, golly, about 6 years, and she's still doing well.
Wow.
She's still in a complete remission. She now has a little boy at home that she gets to be with and make sure it never gets lost.
It's such a beautiful story. I did love Rennie's story. And, it does talk, you don't know, because when they first brought her in, you weren't sure, right? You can't say.
Correct.
And so you just gave them the options, and in her case, it worked out. And I guess that's part of life anyway, is we need to have faith and trust that, we can just show up and do the best that we can. And, right. And
Exactly.
At some point, turn some of this stuff over. Is there anything you want to leave the audience, the women listening with today? Any final thoughts or?
I guess two.
Please.
One thing is that as a veterinarian, I'm going to tell you that there is no wrong answer, right? Any of the decisions that you are faced with making, as long as you are doing it with your pet's quality of life in mind, no matter how long or how short that time span might be, it will always be the right answer. There are no wrong answers for that. And I guess the second thing is something that someone had recently said. She's someone in the publishing industry. And she said, after I read your book, I felt that I was a better dog parent. I felt that I was a better person, and I felt happier. So I hope that's what other people experience as well.
Beautiful. Thank you again, Renee. Renee is the author of Sit, Stay, Heal, What Dogs Can Teach Us About Living Well. Where can people find the book and connect with you if they want to learn more about your work?
Thank you. So the book has a website, sitstayhealbook.com, and heal is HEAL. I have a bunch of events and different things, so you can find it there. And then the book is sold where most all books are sold. It's on also Amazon. It's an audiobook. It's on Audible, Barnes and Noble. So it's just been a really great thing. I feel very, very fortunate. I'm very grateful. And I'm so grateful to you, Michelle, for having me on. Thank you so much.
Oh, this has been amazing. And in my show notes over at thegoodlifecoach.com, I'll have the links so that anyone who's interested in finding all your social handles and getting access to the book can do that. Renee, thank you for taking the time to write this book. I hope that it was healing for you. I imagine it was.
It was emotional.
Yes.
And that was exhausting, but in a good way.
Yeah.
Yeah.
Yeah. Well, it's such a beautiful book. And like I said, I felt honored to be a part of these stories and then also your journey. And we will send you good vibes for continually feeling good and getting stronger every day. And thank you for the work that you do in the world. It's such a gift to all of these families that you help. And thank you for your time today. So appreciate it.
Oh my goodness. Thank you. Take care.
Thank you. Thanks so much for tuning in today. I hope you gained some new information or inspiration for your life. That the essence of this show is to really wake up to what's possible for you, to reclaim your beautiful voice, and to really learn to love and prioritize yourself. So if you gained any value from any of the conversations you've tuned into, make sure to subscribe on your favorite podcast player. You can do that right now on your phone. And please do consider leaving a rating and review if you have yet to do so on Apple Podcasts. It's actually how more women can find the show. And I really want to grow a community of women who are loving themselves and living full on. So thank you as always for tuning in. And I look forward to reconnecting with you next Wednesday. Bye for now.